Unfortunately, today we find ourselves in a very difficult situation. We are almost there in 2010. We have made commitments at the global level to reach universal care, treatment, and prevention, and yet only 1/3 of the funding is currently available. We are calling at the International AIDS Society on the G8 to deliver on their commitment of full funding for this very important initiative. It is quite clear at this time that the lack of political leadership at the international level is inhibiting us from meeting our deadlines in terms of the support of the role of antiretroviral therapy, prevention, and care. This is a grave mistake. People could argue that at a time of a difficult financial crisis, priorities should be realigned, and that is actually a mistake. We know that we can control this epidemic by developing a very aggressive rollout of antiretroviral treatment, care, and prevention. If we don't front-load this investment now, we're going to pay the dividends in the future, and this is going to become really expensive and very difficult to sustain. So we're calling at the International AIDS Society to make that investment now so that we can prevent what it can be a tragedy in the future. The difficulty is that today, by not meeting our financial commitments to fight HIV globally, we are creating an ever-growing epidemic, the rising number of new infections in the order of 6,000 to 7,000 a year, inordinate amount of death, with the devastation, the social devastation that it creates. This is unacceptable. The International Society is calling for the funding gap to be resolved immediately so that we can avert what can be a long-term crisis of an unsustainable nature. It is clear today that in order for us to get the best return from our investment, we need to be very smart how we invest those monies. And so we want to allocate the funding to treatment and prevention, and treatment as prevention, because we now know that if we actually prioritize these two areas, we can make a big dent on the epidemic, and that can have